Well, hello everyone. My name is Brenda Gridley. I'm one of the dietitians here at Ironwood, and I wanted to talk today about radiation fatigue. I'm sure all of us with our, going through our treatment and our radiation or chemotherapy, we experience this lack of energy, this constant tiredness, and that is not only just from the treatment itself, but from other factors that can contribute as well. Number one, just the cancer itself takes a toll on your body. The treatments, chemotherapy, radiation therapy, bone marrow transplants, and even surgery. Then you have the side effects that come along with treatment, such as anemia, which is a lack of iron or red blood cells in the body, which can cause tiredness. You have your nausea and vomiting, which is also depleting your body from the nutrients and the fluids. You have pain, insomnia, and even mood swings can contribute to fatigue. These emotions that come along with your diagnosis and the treatment itself is anxiety and depression can really wear you out as well. Medications, the pain relievers, they make you tired. Sometimes you forget to eat because you're taking a nap and then you're missing out on a meal. That leads to poor and inadequate nutrition and hydration. And then also just lack of movement. If you're tired, you don't really feel like moving around, but actually the best thing to do is to get up and move around, get your blood circulating, activate your muscles. So there are some nutrition tips that I want to give you to fight this fatigue. Simple dietary changes or even lifestyle changes during treatment can help improve your mood, improve your energy to help get you through this. Unfortunately, when we have cancer and when we're going through this treatment, our bodies become hypermetabolic, which means that we're using more energy, we're using up all the calories and protein that we're eating. When it would sustain us normally, it's not enough during treatment. So you have to make sure that you are increasing your calorie levels and your protein intakes. So how to do this would be to eat 4 to 6 small meals a day. So what this does is it helps to release sustained energy without going into long periods without food. Focus on protein. Protein is extremely important. So good sources would be, you have your animal protein and you have your plant-based protein. So you could do chicken, fish, eggs. Then you have your beans, your nuts, your legumes. Just a little tip on how you can get more protein into some of those recipes would be to add a scoop of collagen powder or even some powdered milk into casseroles, soups, even your oatmeal in the morning. So iron can help improve your energy levels because this helps combat that anemia that you're having. So try to incorporate iron-rich foods if your blood counts are down. Egg yolks, beans, whole grain breads, liver. I don't know if a lot of people really were going to eat liver, but liver and also your poultry and your red meats are good sources. So a little tip is to, when you're eating these foods, to try to add a vitamin C source. Vitamin C helps to absorb this iron better. So have a little glass of orange juice, or other sources are broccoli, tomatoes, and then obviously your citrus fruits. Hydration. A lot of times if you have a headache or you're fatigued, just in general, it's because you're dehydrated. If you wait to that point, then you kind of have to overcompensate. So you have to make up for what you've lost. So aim for at least 2 liters of water a day. Sometimes water can be boring, so you can, spruce it up, slice some fruit, some apples or even orange in there to make it flavored. 100% fruit juices are good as well, and unsweetened teas. What you want to avoid, and what we all kind of tend to go for, is when we're tired, we go, oh, we need caffeine, we need coffee, we need, tea, the energy drinks. That will make you feel better initially, but then when you crash from the caffeine and the sugar leaving your system, it's going to even worsen your fatigue. So really try to get that water, flavored water, body armors, sugar-free Gatorades if you're trying to avoid the sugars. There's also fluids in foods naturally, so foods that melt at room temperature could be like Jell-O, ice cream, sherbet, and also soups made from broth. So bone broth would be an excellent source of hydration, and it has a lot of electrolytes in it. So we may not think that chewing can wear us out, but if our body is going through this, you really want to conserve energy the easiest ways you can. So find foods that are easy to chew. If you're trying to chew down, a big old burger or a steak, it's going to take a lot of effort to chew that down so you can swallow it. So go for the softer foods like cottage cheese, oatmeal, soups, hummus, casseroles. Those all can help prevent that fatigue from the chewing. So everyone always says, try to cook from scratch and don't buy the prepackaged meals or the convenience foods. But during this time, it's okay to lean on those a little bit. You can go for those frozen meals or the canned soups. Even on days when you're actually feeling really good and you feel like preparing a meal, you can make a little bigger portion and divide it up. And then all you have to do is just reheat it when you're ready to eat your next meal. There's also lots of curbside grocery delivery services where you don't even have to get out of your car, or they'll just bring it to your house. So that can help you out if you're too tired to go to the grocery store. And then also, you can ask our social workers. There's lots of community services that are willing to bring meals to your home, and some of these might even be approved by insurances. Your family and your friends, if you're lucky to have that support group, really take advantage of them. I'm sure they're going to want to bring you lots of meals. They want to try out new recipes. So just let them bring the food and just store it properly. And it'll ease some of that stress on, I have to eat something, it's going to be already there for you. So another tip could be to have easy to grab snacks on hand. So these could be like cheese sticks, protein bars, hummus, and pita. This will make it easier for you when you are trying to consume those 4 to 6 small meals a day. So as I had mentioned, fatigue doesn't really go along with, let's go do something physical. Physical activity doesn't mean you have to go to the gym or, have some crazy workout routine. It could be just getting up every hour, even if you're at home, just walking around the house, or taking a stroll out into your backyard and getting some fresh air. There are many benefits to physical activity as far as maintaining a healthy BMI, which is known to be one of the cancer preventions, to have a healthy body weight. So there are some guidelines that you can aim for when you're feeling up to it. Minimum of 150 minutes of moderate activity or 75 minutes of vigorous physical activity a week. Of course, if you're going over the 60 minutes, that's extremely fine if you're feeling up to it. So Exercise can be fun. It could be dancing, it could be going on a bike ride with your family or your children. Whatever it is, keep it interesting. Also try to incorporate some weight training activities, such as light weights when you're sitting and watching TV. This could be just 1 or 3 pound weights, and you could do bicep curls, or you could do shoulder extensions, anything to keep that lean muscle mass up. So lastly, it's important to support not only your body but your mind. So taking periods just to yourself, short relaxation periods, whether it's meditation or you just want to go and take a little cat nap. Keeping on a proper sleeping cycle is very important. You don't want to stay up late, watching Netflix. Try to go to bed at 9 o'clock every night, whatever it is that is conducive to your schedule, but don't preclude that sleep time with screen time. Try to read a book or practice, meditation or even journal. Caffeine. So you really, in the morning, of course, we want our cup of coffee, but really try to avoid that caffeine later in the day, because, even though you feel like it might wear off by the time you go to sleep, it still can have effect on your whole sleep cycle for that same day. Alcohol, you want to obviously avoid that as much as possible, and if you are going to drink in moderation, alcohol can tend to dehydrate us, so that was another factor for fatigue. So try to limit your alcohol intake. When you are, thinking about your treatment and being social and doing the things that you did before your diagnosis, it's important to try to remain as normal as possible. If you were in a book club, or you went out with your friends every Friday night, you went out to lunch or something on the weekends, try to maintain those activities. The communication and the support you get from those people are going to help boost your mood, and that can help with the fatigue as well. When sometimes people, when you're tired, you want to eat candy or something sugary that's going to help boost your energy level. Same with the caffeine. If you do this consistently, this can lead to weight gain, which can only can worsen the fatigue. So if you're feeling hungrier, or you're feeling like you need to eat something, go for those healthy choices, especially the protein. So when you're talking about mindful eating, this is a really good plate. I got it off of Amazon, and it's perfect. It shows you exactly what balanced meals should look like, with your dairy, your grains, your fruits, your vegetables, your protein. I eat off of it. My kids love it because it's all divided and nothing touches. So it might be a little tool to help with balanced mindful eating. So your vitamins and supplements, I know this is a big question I get a lot of, is can I still take this during treatment, or is it going to interfere? You really want to bring all your supplements, even including herbal, even your teas, bring them up to your doctor. Make sure that they're safe during treatment. There are some supplements, especially high doses of vitamin C or other antioxidants, that can actually interact with successful treatment. Try to get your vitamins and minerals during this time through balanced meals, through your food. You can meet your vitamin and mineral needs through balanced meals and snacks. Of course, if you do develop a deficiency, we can, test that with lab results and supplement as needed if it's appropriate for your treatment plan. So I just want to extend our services. Rebecca and I are the dietitians here, and if you do feel like you need a nutrition consult, please reach out to your MA or your doctor, and we'd be happy to talk with you and discuss further. Thank you.